webinar, training online from the joint actions on increasing the capacity building of national focal points. Today's topic is the presentation of the technical support instrument supporting the design and implementation of health reforms. I know that we need to start immediately, as the first speaker, Francesca Catarin from the European Commission DG Reform, is available now. So I will present afterwards the agenda, but first Francesca Catarin will introduce us the instrument and the presentation of the call of this year. Good morning, Francesca. Thank you very much for accepting the invitation. And I give you the floor.
Good morning, everyone. Good morning, Sandita. Thank you very much to you for the organization of this event and for having us presenting the TSI instrument. So I will see if I can share the presentation. Okay. You maybe tell me when you can see the screen.
Yes, we can see it perfectly. Thank you.
Okay, great. I will give you a short introduction of what the technical support instrument is, together with some example, and of course, feel free to ask me a question at the end of the presentation. So, by the way, maybe a few words about myself, because the technical support instrument is actually the main tool managed by DG Reform, which is a relatively new Director General at the European Commission. We were first a service, and now, since the new Commission, we are actually a proper independent DG. So, as I was saying, the technical support instrument, TSI, is an instrument that we manage and with whom we provide tailor-made technical expertise to all the European member states. This technical support is demand-driven and does not require any co-funding from the country that requires this instrument. What does that mean? So when the DG Reform provides support to a member state, which can be at national or at local level, meaning that this instrument can be requested by a ministry, by a governmental agency, but also by public administrations at regional or local level, also in the outermost region. What the DG Reform provides is technical support. So what we basically finance is the expertise. I will show this point later. We will basically finance the expertise that goes on the ground, but we will not give money to the beneficiary of this instrument. It is demand driven. And this means that basically the beneficiary can request support in any policy area that it requires the support. In this case, we're speaking about health. I will showcase some example of area where we intervene, but also within the healthcare systems, we really cover different parts from healthcare, but also public health.
Sorry, Francesca, may I ask you, please, if you could present in a presentation modality? Yeah.
Like,
if possible, yeah.
Like this?
Okay. Yeah, much better. Thank you.
Sure.
So
Okay. Thank you. And a last point, we can intervene in every point of the reform from the very beginning, when, for example, the beneficiary is thinking about how or whether to develop a legislation, or during the implementation of such a regulation or measure, by providing also capacity building with the pilots project. So how does it work? Basically, we work in a cycle. Every year, we open a window for the beneficiary to apply to this instrument, which is from middle of May to the 31st of October. So during this period, the beneficiary has the possibility to go on our website, download the template, and start drafting the request. After the 31st of October, we will have a couple of weeks where, as the G reform, we analyze all the requests that we receive from all the member states, and we select on the basis of certain criteria which selects we will support. Normally around Christmas, like shortly before Christmas, we can unofficially say which requests have been approved. And normally this means that by May, June, at the very early, we can be on the ground. But to be more realistic, normally this is a process that starts around September, October, depends how good then we are on concluding the phase of designing the contract. I speak about the contract because, as I said, the G reform will then pay the experts that will go on the ground, and the selection of the experts and of the provider is based on the type of project. It's a discussion that we have with the beneficiary. Sometimes it can be an international organization, like in the case of health, it can be the OECD or the World Health Organizations. Sometimes we work with private consultancies, or in some other cases, we can have direct grants with whoever we believe that can be adequate to provide the support. To give you an example, this third case, we had the project on addressing antimicrobial resistance in Latvia, and in that case, since we knew that one of the most advanced country to that was Sweden, we asked the experts from the veterinary agency of Sweden to provide support to the agency in Latvia for this project. As I said, there is a selection of the projects. Normally, we approve, I would say, around 1/3 of the projects. At the beginning, it was half of it, but now we are receiving an increasing number of requests, while the number of people working in the G-Form remain the same. So this means that less and less requests are selected, or that that the process has become more competitive. And in this screen, you see the criteria that we use to select the request. We have the urgency, which means whether there is a need to act on the request, because, for example, there is a link with the recovery and resilience plans, because there are country recommendations from the European semesters, or because at national level you give proof that you have a deadline to respect, therefore the support should be provided in that specific year. The breadth and the depth, so how much a need in a specific area has consequences also on other aspects. The type of support which is needed, whether there is whether this is something that you cannot ask for support from other European Union instruments. And last but not least, the administrative capacity. With this, we mean that we expect the people and staff from the beneficiary authority to really engage almost on a daily basis with the experts that will be on the ground. Because, as I said, if on the one hand we do not require any co-funding, and it's us paying the experts, what we do request is the capacity of the country to follow the projects on the ground, also to ensure the sustainability and the commitment from the side of the beneficiary authority. Then we have other criteria like the maturity and the focus and the expected results. Basically, this means that the request has to be very clear in what is the problem, what are the needs, and also which type of support you would like to see through the project. If these are the criteria that we use to select the request, there is also a prioritization which is made on two different layers. The first one is done by the country itself. So let's imagine that Italy receives from all the policy area, 40 requests. It will be the country itself, so Italy, to make a list from the most important and urgent to the list. And this is something that then the G4 takes into account. And the second layer of prioritization is done by a figure which is called country coordinator, which is a person from DG Reform, which oversees the whole portfolio of projects within the country. So on the basis of this prioritization, the selection will also be done. So you have on the one side the assessment criteria, and the second elements are the prioritizations list. As I said, there has to be an added value and an impact on the ground, and especially the added value compared to what can be replicated in other European member states. And of course, avoid overlapping, because if a certain action has already been financed by another European instrument, in that case, we cannot contribute with a project. In this slide, you can see the type of support that we can provide. As I said at the very beginning, we can act in all the cycle of a request. We can help the authority to review or develop a legislative proposal. We can conduct a mapping, so assessing the state of play of a certain situations or services or whatever you believe you need an assessment of the status quo. Promote the involvement of stakeholders through consultations or by building stakeholders involvement processes. We can design a strategy, co-design a strategy, but also action plans to make sure then such a strategy then will be ready to be implemented in the ground. I think there was maybe somebody didn't mute itself. And finally,
di Belgi perché ha fatto un caldo.
Sorry, we kindly ask everybody to switch off the microphones, but thank you.
Thank you. And then last but not least, the capacity building aspect. It's something that we always try to insert in our project, exactly to to roll out what we design in the theoretical part of the project. In this slide, you can see example of areas related to health where so far we have been providing support. We have, of course, the digitalization, from the creation of e-health center to adapting strategy for the digitalization of the healthcare systems, but also building contributing to build the interoperability among the systems. Maybe an important thing to specify when we speak about platforms or IT tools, what we do with our instrument is to draft what we call technical specifications, so the terms of reference for then building or buying such a platform. But we cannot buy a platform or this tool. This is something that the project that through the project we cannot do. We have a number of projects on primary care, from the support, from the setting up healthcare units to developing the basis for primary healthcare systems. This is something that we do particularly in those cases where we see that the system is very much based on the secondary care intervention, so very much hospitalized. We can have projects on public health, on prevention, on antimicrobial resistance, mental health, as we will see later, hospital sector, and also other topics such as the genomic, developing artificial intelligence in healthcare, and so on and so forth. By the way, all these projects that you see here are also available on our website, and I strongly encourage you to have a look because it's divided both by area. So you will find a page only for healthcare and public health, but also by individual countries. An opportunity that we offer that is worthy to mention is the possibility to run multi-country or multi-region projects. Basically, if you would like to opt for this option, you will know that you will be partnering with other European member states in running a project if there are common interests or if there are support measures that are similar. This is slide from last year because the one from 2023 was not ready yet. We're still processing the numbers, but I mean, the priorities that you see here did not change. A big number of requests that we accept and select contribute to the recovery and resilient plans. It was actually the same case for Italy. If I think about the two projects that we have on the ground that I will briefly showcase after, contribute to digital transition, but also the green transition. And on this last point, I thought it was interesting to include it because when we speak about the green transition, it's important to remember that it can also be applied to health, particularly when it comes to the greening of the hospital. We see there is an increasing demand from member states to work on this direction, not only from the point of view of the infrastructures, but also from the point of view, for example, of the energy that is used in these facilities, and so on and so forth. Another possibility that we offer through the Technical Support Instrument, the TSI, is what we call flagship projects. The flagship project is a concept that we started developing 2 years ago, and it's actually a way to further contribute through our instruments to the priorities of the European Commission. So as I said at the beginning, our instrument is very much demand driven, meaning that the country can really propose whatever request they feel they need. But on the other side, also the DG reform proposes this area where we believe that member states should look support, exactly to support the lines of the other DG within the European Commission. Every year we select for different policy areas these flagships. This year, relevant to health, there is the flagship that is highlighted on the slide, which is on mental health, to foster well-being and mental health. And well, I guess that there is no much background to provide on why mental health was selected as one of the priorities. As you know, Ursula von der Leyen, already in her speech in 2021, made clear how this should have been a top priority from the European Commission, particularly in the context of the post-COVID recovery, where it was clear that youth and adolescents were among the category that more than others suffer the pandemic, and because of the pandemic. 2022 was the year of the youth, and right tomorrow there will be a communication, the very first communication of the European Commission on mental health. Because of this, mental health was an area that we suggested to member states already in 2022, and it's an area that we reproposed this year to really show how much this is a priority at European level. As you see, the purpose of this of the support is really varied. The measures that we provide are to strengthen the capacity of the health system to deal with the mental health issues, mainstream mental health in the education setting by promoting activities that can foster this well-being, increase the availability, accessibility, but also the inclusiveness of mental health services, and also support, of course, the workforce that works around this area, from professional like in healthcare settings, but also in other areas such as school or in the community centers. Another flagship that we proposed last year was on integrated care, and I thought it was important to remember that this remain, in an area where we provide support. And I thought about including it also because this is actually one of the requests that was selected for Italy in 2023. So basically for the previous round. On health, there was this request on person-centered integrated care, which was a request put together by the Minister of Health, the Minister of Social Labor, and supported by ProMIS, and exactly on mental health. Another request was presented by Italy and was selected was the flagship on digital skills to increase the quality and resilience of the health systems in Italy. And this is a project that actually at the end put together two of the requests that we received from Italy, one which was from the Minister of Health, again supported by ProMIS, and another one from the Dipartimento per la Trasformazione Digitale. As a DG reform where we received the two requests, we realized that the two requests had many aspects in common, because one was to define the set of skills necessary to improve the health literacy of healthcare professionals, and the other request was to increase the use of the electronic health records, as Italy had included in the RRP. So what we did, we put together these two projects, and here in these slides, you can see you can see how basically we declined the project on the ground. We started with an analysis of the situation to see which was the level of digital health literacy in Italy, how much was the use of the electronic health records, how the trainings were provided. And then we progressively defined, which were the steps to get to the definition of the strategy, the roadmap, and then the definition of training modules for healthcare professionals. And last but not least, I want also to inform you about this new opportunity that we offer since last year, which is an exchange between public officials of different administrations. And again, it's an opportunity we offer to increase the dialogue, and through this dialogue also the skills and the expertise of the officials that works in the public administrations. It takes the form of a visit, but the idea behind this is to really contribute to form the expertise of the people that once they are back in their administration will contribute to work on a specific reform or legislative proposal or area where they would like to replicate a positive experience of a member state. It's fairly simple as an instrument to apply, but what we want to highlight is that even if, at the end of the day, we're speaking about individuals moving from one country to country, it's really important to have, a project over which you want to work on and over which you would like to get expertise by the exchange with other member states. And this exchange can take can be a very short exchange from 5 days, but can be extended up to 3 months with the possibility also to come back in between. And of course, we also ask a final deliverable to showcase what was the learning path for this exchange. Although this final deliverable is again relatively smooth to present, and it takes the form of a final report or a little study. And with this, I thank you for your attention. In our website, you will find additional information, but if you have any question, I'm glad to address them.
Thank you very much, Francesca, for the comprehensive presentation. Thank you for your time also. And I am glad that we managed to finish on time your intervention. Thank you very much also for highlighting some projects and providing some examples with regard to the digital health, the primary care and the public health, because our aim here is to reinforce the capacity building of the national focal points of EU4Health. So this is one of our objectives within the joint actions, but not only. We are also supporting the implementation of the EU4Health program, and as we already know, the necessity to stimulate and create synergies is a main priority. Thank you also for highlighting the examples that ProMIS is currently working on. We will have the chance now to discuss a bit further. So colleagues, if just right now you have some questions to ask to Francesca, I think we have still a couple of minutes available. Otherwise, of course, you can address the questions to us and then we can reach out to Francesca from DG Reform. I don't see any
Excuse me.
raised hand. Yes,
yes,
please.
This is Cristina Medina from FPS from Spain. I would like that if you could, Francesca, could explain better the public administration cooperation exchange. How does it work, or how is the process of applying, or?
Yes, thank you very much for your question. So this exchange, as I said, has as an objective that are reinforcing the skills and the expertise by providing a peer-to-peer exchange. So to do that, let's imagine that you work on an agency that would like to know how, for example, I take a concrete example, how a particular country is dealing with antimicrobial resistance and how they are implementing the action plan for the European Commission. And you know that there is a particular country that is very much advanced on that. What you can do is to apply through this program. You will find a template in our website where you will need to indicate which is the area you would like to work on, why you would like to ask for this exchange, and there you have the possibility either to already indicate which is the country or the institution within the European member state that you believe is the best place to provide that type of support, or you can simply say, I'm interested in this, but I wouldn't know which is the country or the institution best place to provide this support to me. And in that case, it will be a staff of DG Reform which will look into your request and will create the match with the peer that we believe being a best place to do that. Another a concrete operational aspect is that you both the person who will go through this exchange and the peer who will the host institution, let's say, will receive a per diem. I think this is also indicated in the template, or if not, it's in the website. And it's pretty flexible. You saw that it can be very short, or be extending up to 3 months. During this period, you can come back because, for example, you would like to discuss what you're learning with your your colleagues at home, and then go back again. And then for the final delivery, these can be discussed during the process. It's not decided prior to your request. I don't know if
it is also at a regional level, or it works only at a national level?
No, it's also at the regional level.
Okay, thank you.
Thank you very much, Cristina. And thank you, Francesca, for the interesting answer. And let's see, any other questions? No? If not, colleagues, you can also write in the chat, of course. And the PowerPoint presentation will be also available on our website as always. Okay, so Francesca, thank you again. I know you had a very tight schedule, so it was really an added value for our webinar to just again present and receive further information with regard to this program and instrument. I will present quickly the agenda, as I didn't have the time in the beginning. So again, this is our webinar today with regard to this technical support instrument. After the presentation from DG Reform with regard to the general overview, we would like to deep in also with two examples of a flagship TSI initiative on integrated care and a multi-country TSI initiative on youth well-being. And these are two examples with regard to the presentation of the procedure and of the call. We don't want, of course, to just provide information of the content. We believe that it is important to understand the process, and we hope that it will be useful and inspirational for the colleagues as well. The presentation will be by Giovanni Viganò from ProMIS, and I give you the floor.
Thanks a lot, Sandy, for the introduction, and Francesca for the very comprehensive and detailed presentation you have done, so beneficial for my presentation. I'm Giovanni Viganò. I'm a consultant expert in social and health policies. I belong to the ProMIS staff, and what I would like to do today is to give you an example, actually two examples. One of them was already introduced by Francesca a few minutes ago, of the process of making a TSI project. I will start sharing my presentation, so just give me a couple of seconds and just tell me if you can see the presentation.
Yes, Giovanni, perfect presentation.
Thanks.
Okay. Yes, we can see it very well.
Thanks a lot, Sandy. So coming back, I'm giving this presentation because we've been involved as ProMIS directly in the preparation of two TSI initiatives last year, in the last year call, that have gone through a specific process of making and selection. The process is still ongoing, actually, since there has been an official pre-selection decision by the DG, but the design phase is still ongoing together with DG Reform. But what I would like to focus on today, on two different examples, is the making of the technical proposals and the behind the scenes of the process of identifying a reform initiatives at country level or at a multi-country level, and identify this reform as a possible opportunity for a TSI initiative in order to get the support from the DG Reform. Both the example that I'm going to present will be, of course, relates to health and health policies. The first one will be about the integration of social and health policy for non-self-sufficiency. And the second one will be a support to mental health intervention for minors and adolescents. I will show you how the reforms have been selected and how we decided that the TSI initiative could be a good opportunity in order to get the support from the Commission. One of them, the first one that I will present, is a national initiative that actually involves more than one ministry, not just the Ministry of Health, but also the Ministry of Social Affairs, together with the regions, together with ProMIS. And the second one is a multi-country initiative that involves not only Italy, but also Slovenia as coordinator. So I'm starting the presentation from the project that actually was already mentioned by Francesca in her presentation. It's a TSI 2023, so the last year call, flagship towards person-centered integrated care. So there was a specific topic for what concerned integrated care, and the topic of the initiative was supporting integration of social and health services in long-term care in Italy. So it's a country initiative specifically targeting a major issue at country level, which is the integration of different services, social and health. Clearly, it's not only an important thing for our country, for Italy, but can be identified as a priority in many other member states in Europe. But we specifically addressed some very important reform initiatives that are still ongoing in our country, in order to get the support from the TSI initiative. So what is about the flagship TSI initiative under person-centered integrated care? So the flagship aims to support the member state in designing and implementing structural reform in the areas of health, social care, and long-term care. And the initiative helps strengthen the coordination between all these sectors and the integration of different levels of care delivery, putting the person at the center of service to ensure better access and quality of care at every stage of life. Integration of social and health policy is a crucial aspect in Italy. Ministries, the competent ministries have been working on this topic for a long time, actually, but still there is a lack of integration between the work and the care which is provided by the social sector and the care which is provided, the support which is provided by the health sector. There are important reforms in place. Now we will show you which one. We specifically address the topic of social and health integration for what concerns, for what regards non-self-sufficiency, non-self-sufficient people. So we mean disabled people and elderly people with non-self-sufficiency. So the healthcare helps people manage their medical condition related to the aging and the chronic condition, and the social work service provides support that can cover any service, facility or resource, personal care, and social work, and then to help people receiving social care live peacefully. The idea is that most of the time, even though both services provide their support, the integration lacks. And since it lacks, sometimes the appropriateness and even the effectiveness of the intervention sometimes is compromised. So a better integration can help to improve the quality and the effectiveness of the intervention that are delivered, especially to the most frail people, such as the disabled people and the elderly people with non-self-sufficiency. So the long-term care encompasses care for different age groups and provides a range of services and assistance to people who need help with activities of daily living and require permanent nursing health care. I will show you that we specifically target one specific sector. When we talk about long-term care, of course, there is a variety of different supports that are provided to the person and to the family, such as residential care services, semi-residential care services, and home care services. We specifically targeted the home care. So the support provided to disabled people and their families, and to elderly people and their families at home, and how to integrate the health and social support at home for those target groups. The situation in Italy and the need of specific initiatives was analyzed at the very early stage of the presentation of the proposal. And actually, this type of analysis is something that is required at the very early stage, at the very beginning of the presentation of a TSI initiative. And of course, you have as a member state to demonstrate to the DG reform that there is a need for support. because there are things that actually need to be changed or better designed or better implemented. So what was the situation in Italy according to the literature, the evidence, and the analysis and the policy analysis that we have done? And of course, according to the involvement and discussion with the competent ministries that have been involved since the early stage, of course. So there is lack of integration of integrated models between health and social care to achieve more appropriate territorial arrangements and individualized projects. These interventions, of course, do not just involve the national level, but also all the other levels, regional, and we will see also at the local level, that are actually involved in the process of not only implementing, but also delivering the services. So I'm coming back to the question raised a few minutes ago. Of course, also the regional levels can be, and the local levels can be also involved, even in the preparation of the proposal. And actually, it's what happened in these initiatives when regions, thanks to the initiatives of ProMIS, were involved together with the ministries in order to analyze the situation and then define the technical proposals that was submitted and then pre-selected. Problem, unconnected or integrated information, or not integrated information systems between health and social care at national level, but also at territorial level. There was a problem in about how the health and social services communicate together. There is a lack of communication and a lack of interoperability between the system, the social and health information system at the national and the local level. And this is an issue that needs to be faced and that needs to be supported. And that's why we believe that the TSI initiatives was an important instrument to support this process. Our responsive services to the evolution of users, the complexity and the multi-problem aspect. The fact is that when we deal with such a complex population, such as the disabled people and elderly people with non-self-sufficiency, you have a variety of problems, a variety of needs, not just under the health dimension, but also under the social dimension. And these complexity need to be faced by and addressed by services in an integrated manner. Then there is poor coordination in the territorial nodes, such as the district and local social and health agency and the municipalities. There are different competencies, also from an institutional point of view, and that's why there is a need of a better coordination between health and social institutions, even at local level. And that's one of the major support that we believe the TSI can facilitate in the making of the initiative. In particular, for what regards the planning of the social and health initiative at territorial level. And in particular, if you look at the last lines of these slides, we specifically identified those reforms that were in place already, that have been just defined in the last years, and that the TSI initiative could support in our ambition, let's say. We have two main plans for what regards the topic of integration of social and health services. The first one is a ministerial decree 77, which has been published in the year 2021, providing instruction and indication to the regional and local levels about how integrating social and health care. These have to do with the new standards and ways to deliver assistance at territorial level and how to integrate social intervention and health intervention. And the other one is the National Plan for Non-Self-Sufficiency 2020-2024, which has been published by the competent ministry, which is the Ministry of Social Affairs, that actually has a very similar view to the DM77, which has been published by and designed by the Ministry of Health. The problem is that we need to find a way to harmonize their objectives in order to have a better integration of the services. So the TSI initiative was also identified as a possible bridge to harmonize different policy initiatives, different reforms initiatives involved in the two ministries, social and health. Some of these reform initiatives, such as the one that I mentioned in the DM77, is part of a reform process of the recovery and resilience plan, the National Recovery and Resilience Plan under the Mission 6. And there are also very important initiatives for investments under Mission 5 and also Mission 6 in the area of self-sufficiency. So the TSI initiatives is taking together, is actually embracing all the reforms or all the relevant reforms under non-self-sufficiency and integration of social and health policies, and also the relevant investment under which are underway right now from the recovery and resilience plans, and also the other initiatives that of reforms that have been promoted by the competent ministry. So you see that with these initiatives, we wanted to bring together all the relevant investments and reforms that were ongoing in the last years in our country. So what were the objectives and the expected results? Of course, we would like to integrate health and social care and long-term care, at least to support the process. We know that it's a process that is taking a lot of time in order to become fully operative. But we believe that the TSI initiative can be a very useful starting point in order to have a fruitful collaboration between the competent areas in the health field and the social field. Then create a system in which healthcare providers act in a coordinated way for the benefit of the people. It's not only about the policies, it's not only about the reforms, but it's about facilitating the work of professionals and the work of services at local level in order to integrate their work. Then improve people access to and quality of service. Of course, the main goal here is to increase the quality of the services which is provided to non-self-sufficient people, disabled people, and also elderly people with non-self-sufficiency, and then support the implementation of EU health and social care priorities. There are also very important initiatives of reforms under, for instance, DG employment for what concerns the long-term care implementation process that are part of this process. And there are also initiatives from the Recovery and Resilience Plan at the national level that actually are considered in the implementation of the initiative. The expected results is to have integrated models between health and social field defined centrally in full coordination between social and health policies, with a support and in support of regional and local levels. Then we would like to have, at the end of the day, information systems which are integrated between health and social care, operators with which are oriented to multi-professional and an holistic approach, and services fully responsive to changing users about complexity and the multi-dimensional needs of the people. So what are the partners that were involved? Of course, when you plan and design TSI initiatives, you do not only have to identify what are the needs and what are the reform processes which are ongoing or that need to be designed, but you also have to embark since the very beginning and involve since the very beginning all the competent authorities and institutions that are actually responsible for those reform implementation and designs. In this case, for the initiative that I presented, the Ministry of Health, for what regards the health component, of course, where the General Secretariat, the GL Planning, the unit for the Recovery and Resilience Plan, the DG of Digitalization, they were all involved since the very beginning. I have shown in the previous slides that actually most of the topics that we addressed are not only about the main reform strategies, but are also about very concrete aspects, such as the information systems, such as the link between the investments ongoing at territorial level through the funds of through the financing of the recovery and resilience plans. And so all the DGs, all the competent DGs were involved in order to make sure that the analysis of the needs was complete, and in order to identify from the very beginning the correct indication to include into the technical proposals. Then, of course, the Ministry of Labour and Social Policy, which was competent for one of the main reform processes that I mentioned, such as the National Plan for Self-Sufficiency, and also for one of the two missions of the Recovery and Resilience Plan, which is crucial for our initiative, which is Mission 5 for cohesion policies. And then, last but not least, ProMIS and the regions. ProMIS as a facilitator and in support of the ministries in order to facilitate the dialogue between the ministries and in order to prepare the technical proposal, and then the regions themselves. We said that it's not all about national issues here. It has also had to do with a vertical approach involving not just the national level, but also the regional level. And this has to do also with the institutional framework of social and health policy in Italy, which is strongly regionalized. And if there is an institutional framework which is so complex and regionalized, of course, you have to embark from the very beginning also the competent authorities that are part of the process. And all the regions and autonomous province actually participated from the very beginning in support of the TSI initiative, also helping defining the strategies and the content of the proposal. It's not only about institutional partners for Italy, but this adventure actually also includes other support institutions. Of course, DG Reform. DG Reform is actually an institution that somehow is facilitating and also sometimes guiding the construction of the technical proposals, giving support since the early stage to all the initiatives that are submitted. But then, when you are pre-selected, like in our case, it supports the designing of the final TSI initiatives, together with an expert organization that was mentioned by Francesca Cattarin a few minutes ago, can be a consultancy organization or an international organization. Nowadays, it hasn't been identified yet who will be the organization supporting us, but there will be one, a partner providing technical support in order to finalize and implement all the actions that were included in the initiative. So what was the main process of submission? There was, of course, first of all, the submission of requests for technical support by member states. I will show you quickly the timeline for last year, but it can be replicable also, I guess, for the new initiatives for the next year. Then there is the selection of requests process, and then the provision of technical support. We have been pre-selected in this initiative, and now we are designing the final structure of the operative plan, and waiting for the selection of the technical indirect support, which will be provided by a consultancy organization or an international organization. And then there will be the provision of the technical support when the initiative will start. We expect soon after the summer. So this was the timeline for the TSI 2023. So the old initiative. This is not for the next year. This is the last year. the one we participated in. So there were in May, so approximately this time of the year, the annual conference of the TSI, and then the TSI rollout country visit for all the spring and summer. Then the member states or the authorities that want to apply to the call can start identifying the reform process at national level and then preparing the technical proposal. The portal, the IT portal for the submission of the technical proposal was in October, as you can see, and the deadline for submission was at the end of the month of October. This was the template for request for flagship technical support. In part of the template, it is also pre-filled. There is a sort of guide from DG Reform on how to complete and fulfill all of the boxes. Of course, you need somehow to customize the initiative according to the specificities of your country, but of course you have to stay in line with the main objectives of the TSI, of the flagship initiative that you are addressing. Okay, so the support is really facilitated by the guidelines which are provided by DG Reform. Then in November, December last year, there was the analysis of the request by the Commission, and then a preliminary communication arrived in January with the results to the member states, and that's when we actually had our pre-selection communication officially communicated, of course. Now we are in the designing process, the one that Francesca Cattarin presented a few minutes ago, together with DG Reform. And we believe that by the end of the summer, we will have, by the summer, let's say, of this year, we will have our executive plan, and then we can start the initiative, the TSI support in the end of the last quarter of the year 2023. Of course, the timing and the timeline of the TSI initiative have to be synchronized with the reform process that you have in place. Of course, also the time frame of the objectives that the reform process that you want to support have to be in line with this timeline. So my recommendation is also consider the time variable when you identify the specific reform that you want to select, because actually the TSI support starts in a year time. Finally, what are the activities that we are planning to do? They are in line with the type of support that also Francesca showed you, but just to give you an example of the support you can receive from the TSI initiative. We will have a mapping and analysis of existing IT tools and organizational systems at the national, regional, and territorial level to support the assessment and management of integration of management of non-self-sufficient people. So the idea is to map the state of the art for what regards the integration problems that we have, integration between social and health services at the national and local level as well. So all the levels of governance will be involved in the initiative. It's not something that you are just doing in your ministry in the capital and that's all. You actually involve the specific territories. You will see now also with pilot activities in order to experiment and to pilot the general guidelines and the general support initiatives that you define from a theoretical point of view, let's say, and then a feasibility study with respect to the application of social prescribing in the Italian context. This was another priority that was identified by the competent ministries of health and social policies to apply the social prescribing in the Italian context, the fact that we now have a TSI initiative, which is a European initiative, is a plus. Also to identify and transfer international good practices, European good practices that are working in other member states and that can be transferred to your national context. So another plus of the TSI initiative is the possibility to get in touch, to facilitate actually the link between good practices with good practices that are going on in other states. And then the development of strategy and the roadmap to support and develop integrated care models. This is the most important thing. Of course, we have reforms providing guidelines and objectives. What we are doing in the thanks to the TSI initiative is to define technical strategies in order to make them possible, to realize them and to implement them at local level. And then pilot the strategy in regional contexts. Some regions will be identified and some local districts will be identified in the selected regions according to theoretical selection criteria that will be defined in order to guarantee heterogeneity to the different types and the different organizational models that are present in our country. Of course, we are defining, thanks to the TSI initiatives, let's say, general guidelines for all the territories, but then you have to go and check whether they work in different local areas. This is something that will be possible with the TSI initiatives, thanks to the pilot implementations in some regional contexts. And then analysis of good practices from other member states for what concerns, for what regards integration of social and health policies and services. Again, I'm coming back to the same message. The fact that we are included in a TSI initiative of DG reform really helps, not just to work in your home, let's say, but also to look out of the window and out of the box and go and identify good practices that can then be transferred to your country, in this case, for what regards integration of social and health policies for non-self-sufficient people. The duration of the initiative will be 26 months. We believe it will start at the end of July, but maybe it's going to be September. We don't know yet. Also, the identification and the setting of the time frame of the duration of the project is an important thing that you need to consider when you plan and design your TSI initiative, because it has to be in line with the objectives of the reform you are addressing. If the reform, of course, is meant to generate results in 2 months, of course, a 26-month project starting in a year is not going to be a good idea. There is no reason to ask for the support of the TSI initiative. So also in the selection of the reform process at national level, also make sure that the time frame is in line with your is in line with the reform process at national level. So this was the first one, okay? Some of the contents actually will be the same for the second example that I'm providing. I will try to stay in 10-15 minutes because I think I would like also to leave floor to requests and questions from the participants. I don't know if we want to just stop and ask for questions now, or we wait for the second presentation.
Maybe if some colleagues would like to address something already now, I think we can give the floor.
So,
if not, then we can proceed. Let's see, maybe. As always, colleagues, don't be shy. You can raise your hand, write in the chat, as you prefer. Okay.
Anyway, if you need some extra minutes to think about a question, I can go on with the second example and then coming back also for question on the first TSI initiative that I presented. The second one, still in the area of health policies, but on a totally different topic. The second TSI initiative that I'm presenting is actually an ongoing process. It was presented in the last year TSI call, so TSI 2023, under the strand Youth First, supporting children and youth well-being, education, training, social protection, and labor prospects. We have understood from the words of Francesca a few minutes ago how important is the topic of mental health in young people at European level. Also, Ursula von der Leyen has highlighted the importance of investing under the topic of well-being and mental health of people after the COVID period, especially for one of the most vulnerable population, which are minors. The initiative that we actually launched and submitted is about supporting the implementation of the Child Guarantee Initiative for mental health services for young people, and especially the integration of services at territorial level, education services, social services, and health services for youngsters and adolescents with problems of mental health. And since it's a very, let's say, European and international initiatives, we believe that was important also to work, that was also a good idea to work with other member states at European level that were actually sharing the same needs and also the same request for a support. The country that we worked with was Slovenia. So the initiative was presented together with the Ministry of Health of Slovenia. We have neighbor country, of course, even though on different scales. And the initiative actually addressed the problem of mental health disorders and also obesity that are growing areas of concern in Europe. And they were exacerbated by COVID-19 pandemic. 9 million of adolescents aged 10 to 19 are living with mental health disorders and anxiety and depression, according to the last report of the UNICEF, the 2021 report of UNICEF, so the last available when we submitted the proposal in late 2022. We have also considered the relevant strategies at international levels, such as the WHO European Childhood Obesity and Surveillance Initiative. When you plan a TSI initiative, and especially when you plan a TSI initiative at multi-country level, of course, you don't only have to take into consideration and analyze what is the situation from the reform implementation path in your country, but also to have clear what are the international initiatives, what is the international reform framework or the programmatic framework at international level from the relevant institutions. We are dealing with mental health and minors. Of course, the main institutions we addressed were the WHO, the UNICEF, the European Commission, of course, and all the other agencies and institutional, international institutions that had something to do or something to say about mental health with adolescents and minors. So Slovenia and Italy were seeking full support to address these two critical health problems, so mental health and obesity among children and young people, with a particular focus on vulnerable young people. There is a particular section of the TSI project that we have designed that specifically addresses vulnerable groups. So those people who have vulnerabilities in vulnerabilities, not just mental health problems or obesity problem, but for instance, belong to minority groups or are marginal, excluded, or hidden population, okay, for which the mental health problems can be even more severe, and the damages can be even more severe on his or her well-being and mental health. So both countries put in place prevention and treatment programs targeting mental health issues and obesity with the support of local communities coming from health, social, and education sector. So again, it's not only about the national level. It's not only about integrating the national strategies for the social field, the educational field, and the health field, but it's also working with the local communities that will be involved, that we plan to involve in the making of in the realization of and implementation of the initiative. The effectiveness of the ongoing programs is jeopardized by a lack of collaboration among the different stakeholders and services supporting mental health of young people. There are reform initiatives. There are even guidelines already in place, both in Italy and in Slovenia. The problem is that they are not effective at community level. And we believe we need for some extra support in order to operationalize these guidelines at local level in a more effective way. The fragmentation of health and social services is due to the lack of common working procedures among professionals and lack of information on support provided by other services. So there is again a need of dialogue between health and social services, mainly, but also educational services who are involved. What are the main strategies at the national level that were identified both for Italy and for Slovenia? And this is part of the game, of course. This is part of the process of finalizing your proposals. Of course, there are strategic programs at international level. We mentioned some evidence from from UNICEF and the WHO. Also at the European level, there are strategies that need to be considered, and you need to align your TSI initiative also to the objectives of the international strategies, such as the European Child Guarantee 2030 and the EU Strategy for the Rights of the Child 2022 and 2027, and the EU Youth Strategy Goals 2027. First of all, you start from there, and then you combine and integrate the national initiatives together with the international ones. For what regards the Italian case, the Italian National Action Plan for Childhood Guarantee, the PANGI program, 2030 PANGI program, which wants to, of course, implement the European Child Guarantee Initiative. It has specific access on psychological and social well-being of girls and boys, pre-adolescents and adolescents, and also access 3, facilitate the access of adolescents with a migrant background or belonging to minorities to psychological care. So it's not only providing support to the well-being of youngsters in general, but it's also targeting specifically vulnerable groups that might show vulnerabilities and vulnerabilities when talking about mental health problems. What regards to Slovenia, the National Mental Health Program. In Italy, we also have the prevention plan, of course, health prevention plan that is in place. Specifically in Slovenia, we have a National Mental Health Program 2018-2028. In particular, objectives 1, 2, 3, 4, 5, 6, 7 of the program. I'm not going into details. It's just to show you the process of how you identify the specific plans of reforms, and then you integrate them with the international initiatives, and then you move forward and identify the need of support from the G reform. So the technical support is providing now a collaboration framework for professionals, wants to provide a collaboration framework for professionals involved in mental health support and obesity prevention of young people, health, social education, and also non-governmental stakeholders that were not involved since the very beginning, but they will, especially at territorial level, with the aim to improve the effectiveness of community programs in place. When you talk about mental health when we talk about mental health for youngsters, the only initiatives that works is the community initiatives, and so you have to engage the civil society at large. So it's not only about anymore a public institution, the main institution in the field, but also involving the society itself, such as non-governmental organization, association, and also families, and also youngsters. We will see that there will be, in the coming slides, some activities that specifically engage minors and youngsters at the territorial level. Not to forget them. They are the main target of this initiative, and of course, the activities cannot forget it. We will assess the current state of play of the cooperation amongst various stakeholders involved in the mental health and obesity support, and the challenges for their cross-sectoral collaboration. Of course, again, the need is to work on the cross-sectoral collaboration of different services. Maybe they work correctly on a vertical level, but what we want to achieve is an effective integration of their collaboration and to ease the process of collaboration between them. Based on a model of care targeted to the Italian and Slovenian context, collaboration protocols will be developed and piloted. Again, it's not very different, of course, from the initiative that I presented a few minutes ago on the person-centered integrated care, because again, we wanted to define protocols, operational protocols for services at local level that aim to put in place effective collaboration between those services, and in parallel, capacity building actions will take place for professionals from different sectors, school, social, and healthcare. We will define a sort of trainers module in order to train professionals involved in all those sectors, to train them about the tools and about the collaboration, the interprofessional collaboration with the other services that are involved. And the sustainable involvement and consultation of young people in health and social issues will be included in a methodology and piloted during this project. Young people will be included. There is a mantra, let's say, that is famous, which is nothing about us without us. You need to involve those people that you are planning and the intervention for. In this case, young people. We will include them in order to listen to their voice. There will be specific dialogue initiatives with youngsters that will be implemented during the process, during the project, during the TSI initiatives, and we believe that will be beneficial also to provide recommendation and indication for the protocols and for the guidelines that we are defining. And it is important that synergies are ensured with the TSI project, with our TSI project that we have presented. This was part of the selection process, actually. We've been asked by the DG Reform how you will integrate this initiative. So since we are talking about integration of social and health services together with education services, with other initiatives ongoing. And of course, you need to provide this evidence. We have submitted also another initiative about integrating social and health services for non-self-sufficient people. We had to demonstrate how we plan to integrate them. And of course, we brought arguments about the fact that the plans of reforms were different. From one side, there was the National Plan for Non-Self-Sufficiency and the DM77 2021. From the other side, we have the PANGI, the Youth Guarantee Initiative, and the objectives are totally different, and the target population are totally different, but we will work in order to integrate them and to find possible synergies and capitalize the work which is already in place. Partners, again, all those institutional partners that has something to do with the initiatives. Slovenia, which is the coordinator of the initiative, Italy's partner, has involved the Ministry of Health, which is the coordinator for this initiative. And another institutional partner for it, of Italy, which is a partner of the initiative, the Ministry of Health, and again, the Ministry of Labour and Social Policies. ProMIS, that supported the initiative, and also dialogue between the Ministry of Health and the Labour and Social Policy Ministry, and also the local level. You cannot forget it. We cannot forget it. also because of the institutional framework of the service, which is strongly regionalized in Italy, like many other member states which are present here. So regions and autonomous province for the health and social departments, of course. They were all included at an early stage and involved in order to provide suggestions to the making of the technical proposal. Then again, for the pilot sites, there will be a selection according to some criteria that will be defined from a theoretical point of view. And then we will implement the pilots in selected local areas in those regions. Then again, we have DG Reform supporting us, supporting the initiative, giving suggestions, of course, and guidelines mainly at an early stage. But this is the guideline and support provided to all the candidates, to all the member states that submit a proposal. And then when you are pre-selected, you have a sort of one-to-one collaboration with DG Reform, helping to design the final executive protocol that will be then implemented in the TSI initiative. And then again, there will be an expert organization that can be an international organization or a consultancy organization that will be selected and that will realize the intervention. I'm taking just a few seconds for the submission process. It's the same of the other initiative. This is a multi-country initiative that we opted for. The form is the same. You just need to flag and tick on the multi-country initiative in the technical annex, and then report, of course, the name of the institutions and the member states that are involved, and then you submit your proposal as a multi-country. And then you, finger crossed, and you hope that the DG Reform will select your initiative. So submission, then selection of requests and provision of technical support. The timeline is the same. The message here, the same again. Please make sure that the reform initiative in your country is in line with the timeline, with the overall timeline of the TSI initiatives. It takes 1 year before the start, so consider this. And then, of course, this is the submission. The start will be again at the end of the summer, let's say in September, for what regard this specific initiative. The duration 26 months. The message again is, please make sure that this corresponds to the reform initiative in your country for the national authorities that you are supporting or that you are providing suggestions to in order to facilitate their submission to the portal. What are the activities? Very briefly, analysis of state of play of the cooperation of stakeholders providing mental health support for vulnerable youth and children, and recommendation for enhanced cross-sectoral collaboration. Proposal of a framework for the development and implementation of a model for mental health provision and physical well-being of youth and children. Capacity building to implement the proposed model for mental health provision and physical well-being for vulnerable youth and children, and then communication, consultation, and dissemination. So again, you have the analysis of the state of play, then designing your strategy, and then providing the capacity building at territorial level, piloting the new contents that you have defined and the new strategies that you have defined, and also implementing the training to the professionals at the local level, and then assess the results, of course, and communicate and disseminate the results you. It took too long. I'm sorry for that, Sandy. You are coordinating the session. I hope it was clear, and especially I really hope it was useful for you in order to understand not just the benefits of the initiative of the instrument, but also to understand what are the right questions that you need to state at the very early stage in order to design an effective project, and hopefully to receive the funding from the DG Reform. Thanks a lot, and I'm open to respond to your question.
Thank you very much, Giovanni, for the very detailed presentation. It was definitely useful for us, I'm more than sure. Also, just to understand how we can then find complementarities among the initiatives. This is again one of our objectives within Work Package 5, led by colleagues from Austria. I know many of you already know the joint action, but perhaps there are some other new colleagues that are joining. And again, I think it was important to just bring up these examples from ProMIS, not because we want to highlight what ProMIS is doing, but because we believe there are very valid examples. And we know that some initiatives from EU4Health specifically indicate the need to find complementarities and synergies with other initiatives, as it had happened for the HPAS project. That has this specific indication, for example, of complementarity with the TSI on digital skills, and not only. So also the examples that you just presented, Giovanni, we understood how to collaborate, how to work together also at the national level. And thank you also for definitely evidencing and highlighting the need to understand at the national level what it is needed and how to interact with stakeholders, and not only. If there are no comments from the colleagues, I would like to quickly ask, for example, which are, let's say, some additional indirect benefits that let's say a country could benefit from a TSI proposal participation?
Yeah, yes, actually, we can actually identify some, let's say, let's call them, as you correctly said, indirect benefits. Of course, we let's take, for instance, the example of the person-centered care initiative, the one done at national level. It was a very useful opportunity at country level to somehow create a sort of national coordination between health and social ministries in order to support not just the harmonization of strategies at national level, the same strategies that I reported in the presentation, but also to create that kind of bridge, that kind of channel in order to facilitate the future coordination of policies. We know how it is difficult to coordinate, sometimes even inside our in a specific institution or a specific ministry. I think that you all know how it's difficult to coordinate various initiatives and various reforms between ministries that have different competencies, for instance, but that share maybe the same vision and the same mission, of course. The TSI actually is a very rich and useful opportunity also to create this type of communication channels and bridges between different ministries, between different public institutions, and also from a vertical perspective, also between the ministries and the regional level that were involved in the initiative. So please also consider and also communicate to the possible candidates what are the possible indirect benefits that these kind of initiatives can provide, not just specific support for one single reform, but more in general and more broader, even other indirect benefits.
Thank you, Giovanni. Indeed, I also think that it is extremely important, again, to understand what is the added value and how we can also increase the cooperation at the national level. And then one last question, then, which elements, let's say, other than what you already illustrated, have to be considered during the preparation phase and the building up of the partnership, let's say, at the national, but also at the international level?
Yeah. Yes, of course. I'm coming back to the things that I think I have already said, but I would like to highlight. So thanks for this question, because it's quite important. And it's also an aspect of competitiveness of your proposal. If you can show to the DG reform that you are able to involve since the early stage the competent authorities for the support that you need, for the reforms for which you have the support, of course, your initiative is stronger, not just at the evaluation stage, but in the implementation stage. So please make sure that all the competent authorities are at the table, at the desk, when you design your initiative and the technical proposal, of course. And also to make sure, but this is more for the multi-country initiative, to make sure that you are establishing a partnership together with one or more countries that actually share a similar, not just similar needs, but also similar reform paths, similar reform strategies for the coming years, in order to have a better harmonization also at a multi-country with a multi-country perspective. These are a couple of recommendations that I feel I can share with the group, with the participants, and that's all, I think.
Thank you so much again, Giovanni. I think it was really interesting and useful. I'm sure colleagues will very much appreciate it. Again, if there are no comments, maybe you need some time to digest all the information. You know, we are available by email. You can write us, you can reach out to the Italian team, and then we can provide you further support. As my colleague Tamara from Work Package 3 is highlighting already, please support us with the filling in of the evaluation survey. It is important for the overall project objectives, and not only, but also in order to measure and evaluate the capacity building of the national focal points. All the PowerPoint presentation will be available on the website, and again, as let's say a closing note, next week again we are organizing other 2 appointments. One, it is closed only for the national focal points because we will be working on the national focal point profile definition and interaction platform. And the next one on the 15th, it will be with regard again to the synergies and together with my colleague Cara from Work Package 5, and we will work again on synergies and present some examples also from the European Commission. But for that appointment, the registration needs to be opened still. And then we will have another appointment in July. So thank you for being so active during this period that is very much intense for everybody before the summer break, but we are also trying to work hard before summer break so that in September we can again start our activities. Thank you again, Giovanni, for your contribution, and thank you, colleagues. I wish you a very nice day. Bye-bye.
Bye.
Thank you. Bye.
Thank you.
Bye. Thank you.